You're listening to India Bio Speaks, your one-stop resource for science, news, and careers.
Hello, everybody. With the recent outbreak and the rapid spread of the novel coronavirus, we at India Bio Speaks wanted to understand how to model the progression of the disease and make predictions. It is a numbers game after all. In our last podcast, we began chatting with Dr. Sitabhra Sinha, a professor in the physics group at the Institute of Mathematical Sciences in Chennai, who works on mathematical epidemiology. We began by talking about how you construct simple mathematical models, as well as a very important parameter, which is a basic reproduction number. If you haven't heard that conversation, please do go and listen to that podcast before joining us today. Now, we will move on to the second part of our conversation with Dr. Sitabhra Sinha. A lot of this modeling is happening real time, and there is a need to be very quick. Can you tell us a bit about the challenges that this poses?
Yes. One of the complicating issues of using modeling to help the control of epidemics in real time is that many of the fancy models which require inputs of lots of numbers are often hard to practically implement. Let me recall at this point an anecdote from 2009 when we had been asked by the Ministry of Health and Family Welfare to help in modeling the spread of the 2009 influenza H1N1. So I was trying to see if we could use network models to try to predict how the disease is spreading through Indian cities. But the information that we were given was essentially all about just the number of cases that were reported in each Indian region on a given day. So when I'd asked if more information could be provided, in particular, something which would illuminate the network along which the infection was spreading between the individuals, one of the doctors who were involved in this data collection exercise told me that even the recording of the data that we had with us was actually obtained with great difficulty. As he beautifully put it, given the amount of stress which the government doctors are already working in, they are asking us, do you want us to fill out all these papers, all these questionnaires, or do you want us to treat the disease? So I appreciated at that point that in the midst of an epidemic, it's actually not very practical to wait for data which is very detailed and can help us do a very sophisticated model of the epidemic, but just to work with much simpler models where we can use the basic data for the epidemic, like just the total number of infected cases, the total number of deaths, and so on. And so there is a value to simple models because you can do this quick and dirty calculations based upon data which is easily available and still be able to say something very useful for the management of the epidemic.
As you mentioned, the human population is more complex than being a set of data points who interact either randomly or uniformly with each other. We have a social structure such that communities within which people interact more with each other. We see differing level of travel patterns. Some people travel internationally, some people don't travel at all. So what are the kind of mathematical tools that you have at your disposal to account for this kind of variance that's seen in the population?
Yes, so one of the limitations of the Kermit-McKendrick style of compartmental modeling is they assumed that populations are well mixed, or in other words, any pair of individuals are equally likely to come in contact with each other. But as we all know, we interact using a social network. We are much more likely to interact with those who are within our community or within our group than with individuals who are outside those groups. So any realistic model of epidemic spreading would have to take into account such social structures. And this is where network theory comes in. So network allows us to understand how the fact that one pair of individuals are more likely to interact with each other than another is likely to affect the spreading of the epidemic. Now, usually in the middle of an epidemic, it's very hard to get the kind of detailed information about social networks we require to run these models and to get real-time information about the course of the epidemic. But after an epidemic has run its course, we can actually do a post-facto analysis, and such network analysis can actually reveal very important insights that can help in controlling further epidemics. Let me give an example. In 2003, Taiwan had suffered very badly in the severe acute respiratory syndrome or SARS epidemic. Now, following the end of the epidemic, a group of scientists had done a study where they looked at how actually SARS had spread in this island, starting with people having brought the infection over from Hong Kong. So when they studied this data, they noticed something very interesting. It turned out that one of the first infected individuals who had come from Hong Kong had gone to a hospital in Taipei and had infected a doctor and a nurse, who in turn had infected their family members and other patients that they had seen, all unintentionally, of course. Now, when some of these patients who had gotten infected in that hospital later on developed symptoms and then went to other hospitals to get treatment, they in turn infected the doctors and patients of those hospitals. And this is how it actually started spreading into Taiwan. So the study basically highlighted that it is not just the social network of individuals that need to be taken into account to understand how a disease spreads through a population, but we also need to take into account the network of people and places. The fact that two individuals who may not know each other and so therefore do not have a social link with each other may nevertheless pass the infection to each other simply on account of being at the same place. And it also tells us the importance that hospitals play in spreading epidemics, unless one is really careful at controlling such spreads. Network study can also help us in understanding how a disease can spread across countries. Again, following the 2003 SARS, two groups independently did a study where they considered the network of airline routes which connect the different countries and showed that by doing the simulations over these airline transportation network, they can try to calculate how, if the disease had started in some place on a particular day, the number of infected cases would grow in other parts of the world. So they tested this with the actual data, and they showed that the model actually predicted fairly well how, after the disease started in Hong Kong, it would gradually grow in places as far apart as Canada and Australia. They did something even more intriguing. They said, what if the disease had started in London? Or what if the disease had started in New York? Using this kind of airline transportation network, they could actually predict that if the disease had started in these other places, how exactly would the numbers rack up across the world? So doing this network analysis studies can actually give us insights at many different scales, right from the scale of how a disease spreads within a city, all the way to how it spreads across the globe.
Thank you for sharing those interesting studies, Dr. Sinha. It looks like a detailed modeling post the disease outbreak is also really important as it helps us to be prepared for future outbreaks.
I think it's important that we have both the kind of simple modeling studies that I mentioned first and the complex models involving networks that I mentioned about later. The quick and dirty analysis using estimates of the basic reproduction number from the data is important because it allows public health professionals and government policymakers to fine-tune their strategy for containing the epidemic. But you also need these complex models which include details of social networks and geography because it helps you to come up with policies to combat future epidemics. I believe that several of the Asian countries did benefit from this kind of understanding that they gleaned from their analysis of earlier epidemics, most particularly the 2003 SARS crisis, and they had mobilized strategies to contain the present epidemic. I'd also like to point out that we are continuously monitoring the data as it's coming in and trying to re-estimate the reproduction number of the epidemic. This is important because it can give us a clue as to how effective the measures that have been already put in place to contain the epidemic are faring, and in particular, what the effect of the lockdown that has been imposed from yesterday would have on the course of the epidemic. Because usually these responses take a long time to be actually seen in the data, but we expect that within a space of about a couple of weeks, the numbers are going to start reflecting these measures.
Thank you very much, Dr. Sinha, for helping us better understand the mathematics of the current COVID-19 outbreak, as well as telling us about both the quick and dirty and the more sophisticated mathematical models that you use. I'm sure that our audience will find this two-part conversation very interesting and useful, especially when it comes to understanding all the numbers and the statistics associated with this COVID-19 outbreak. Thank you all for listening. Do take care, stay safe, and watch out for more updates from IndiaBiospeaks.
If you're passionate about scientific research, communication, outreach, and science education as we are, please connect and engage with us, and here are some ways that you can do so.
Visit our website at www.indiabioscience.org.
Subscribe to our newsletters.
Write for us and join our online discussion forum at discuss.indiabioscience.org.
Advertise jobs, grants and events in the life sciences on our website.
And feel free to contact us anytime at hello@indiabioscience.org.
Until next time, enjoy your science and stay engaged to enable change.